Hello, Dr. Virginia Ellis here today. I am going to be talking about tooth extractions. What is a tooth extraction? It's when your tooth gets pulled and taking teeth out. Okay, be sure to press a like on the button and subscribe to the channel and share this video for those who could benefit from it. All right, Dr. Ellis, what is a tooth extraction? As I just said, it's basically when a tooth is taken out of your mouth. We call extraction is our techie tech word for getting it pulled. And by the way, we don't yank or pull the teeth. We actually wiggle them very gently and take them out very well, okay? It's not like what people think, oh, they yanked it out of me. We don't do that. What are the reasons tooth extractions may be necessary? Well, it could be in multiple things. If you have a huge cavity and the tooth cannot be saved, if you have advanced gum disease where the tooth is just about to come off, got to take it out, where you have infection or impaction. Impaction is when your tooth is stuck underneath the gum line and the bone, and it's going to cause you problems. That's an impacted tooth. Okay, sometimes you can grow like a cyst in there or an infection, and then it has to be taken out. So those are the reasons. What are the types of tooth extractions? Well, there's one called simple tooth extraction. Is when we wiggle the tooth. We don't wiggle, but we kind of put lever force and we go back and forth like I'm going back and forth, and the tooth eventually gets loose, and then we gently take it out. Okay. The other one is called a surgical extraction, and a surgical extraction is an extraction where you just can't wiggle or lever back and forth the tooth, where you actually have to cut into the gum, cut into the bone, and take out the tooth and then put sutures. Sometimes you don't need sutures with a surgical extraction, but usually you do. Okay, so that's the main difference. When would a dentist recommend a wisdom tooth extraction? Well, when they're causing problems or they're going to cause problems, like I just said. If you have wisdom teeth that are stuck, you can't clean, and they're out, partially out. Some people come in with horrible gum inflammations in the back. That happens. You chop food, no matter how hard you try to clean, you got to take those teeth out. Or if they're underneath the gum line, sometimes people leave them there, and I just recently had a person who grew a carcinogenic, cancerous cyst, a cyst that was turning into cancer. He didn't take this wisdom teeth out, and sometimes you can get a complication. So rule of thumb too is if you have impacted teeth, you really should get like a panoramic x-ray, like that rectangular x-ray that checks your wisdom teeth, around your wisdom teeth, once every 2 years, because the x-rays that we normally take here at the office with the little teeny x-rays, I think I have this, see these sensors here? Those don't usually capture or are able to check, reach the image of where the wisdom teeth are, because sometimes they could be way over here, and these sensors don't reach that far, okay? When would braces require tooth extraction? Well, basically, doctors tend to be very conservative when it comes to that, but it's really when you don't have enough space. So if no matter what the orthodontist or braces doctor is going to do, and they say, I just can't get enough space to straighten the teeth and we need to fix your bite, then they'll recommend an extraction when there's not enough space to straighten the teeth or leave you with a correct bite. Because you can also have straight teeth, but your bite can be off. So we want to make sure that the bite is spot on from a functional point of view, and that your teeth are also straight. So two functions. It's not just about looks. Is tooth extraction advisable for young children? It just depends. Usually if a child comes in and they have like cavities, we will try, and they're really young, like 3 years old, and they can wait. We will do like certain other methods, like maybe sodium diamine fluoride, something to tie them over to slow the growth of the cavity. And then when they're a little older, we'll go ahead and do the fillings. It just depends. If a kid comes in and they have an abscess, they have infection, they're in pain, the tooth's got to come out, and then we'll go ahead, we'll either refer, or they'll have to go into hospital dentistry when they're that little to get, numbed up. You usually do have to put a kid under general anesthesia or IV sedation for that. Okay, so the answer to that question is we try to hold off as much as possible unless it's really, really necessary. Okay, if I have gum disease, when would tooth extraction become necessary? That is when the gum disease is just starting to spread and affecting other parts of your mouth or other teeth. That's when we recommend taking out a tooth due to gum disease, advanced gum disease. Are all tooth extractions considered oral surgery? No, they're not. The ones where they're considered simple extractions, where we kind of wiggle the tooth, kind of lever, and then gently take it out, that's called a simple extraction. It's only when you have to cut into the gums, cut into the bone sockets, and put sutures on, usually, that's when it's considered oral surgery. What is the difference between simple versus surgical tooth removal? I just explained it. Simple, wiggle, take it out. Surgical, gotta cut the gums, bone socket, take the tooth out, sometimes in pieces, put sutures or stitches on, that's surgical. Where should I go if I need an emergency tooth extraction? The best place is come call us, because we can evaluate the tooth and we can send you to an oral surgeon. If it's really complicated, sometimes you need to be, numbed up and under IV sedation, just depending on how infected you are. Because if you're really infected and your face is swelling and you're in danger of closing your airway, you got to get that thing out right away. And at that point, you would need like a IV sedation or general anesthesia, because a shot is not going to be the only thing that's going to take care of that pain to take the tooth out comfortably, okay? So basically, to answer that question, I would say call us or the oral surgeon. You can go to the emergency room. Sometimes they have an on-call oral surgeon, but it's just best to have it looked by a dentist, okay? Don't wait till, you just gotta come for your checkup. Sometimes accidents happen and you need to go into the emergency room, but it's just best if you keep up with your dental work, and that way we catch things early. And just highly recommend it that you do the work when we tell you to do it. Don't wait till it becomes an emergency, because guess when it's gonna happen? When you're gonna go on vacation, when you're about to get married, when you're about to have a job interview, when your spouse is out and you have no childcare, when it's a weekend and all the specialists are out. On a holiday or a weekend, that's when it's going to happen. So just make sure that you follow up with the recommended dental care and see your dentist at least twice a year. How long does a tooth extraction procedure take? Usually it just depends on the complexity of your case, okay? I would say 20 minutes for simple, but that's like, the numbing, taking it out, making sure that we control the bleeding, and giving you home care instructions. We call post-op instructions. Sometimes it could take up to 2 hours. It just depends. If you come in and you're someone who doesn't have control bleeding, you're on blood thinners, you had an accident, it's going to take longer to get that under control. Or if you have a tooth that's impacted, that's like next to your eyeball, that's going to take longer than something that's already outside, right? So it just depends. And that's a question you can find out when you're at your consultation, okay? Will I need dental implants after a tooth extraction? Well, yes and no. Sometimes you do. Most of the time you do. If it's in between your teeth towards the front, yeah, I would say that you don't want to walk around without teeth, right? Without a front tooth, that's not good. Or, sometimes if you're missing like a first molar or a second molar, a lot of times that's a workhorse. That really helps a lot in chewing food like bread and meat. So most of the time you're going to need one, unless it's a rear tooth where the tooth that's left and the opposite arch is not going to be impacted by the bite. But most of the time I would say you are going to need an implant or something to replace the missing tooth, okay? Should one avoid rinsing after getting a tooth extraction? Yes, I would say that. Personally, I would say 2-3 days, okay? And it's just because while the area is healing, you develop a blood clot, like a little milky, beige-looking coat around the tooth. And that's the same thing as a scab. Like, how you get this brown, crusty scab? You get that in your mouth, but it's soft. It looks different. It looks beige, kind of like brownish, creamy. You don't want to dislodge that, because if you do, then you're going to bleed, and you're also going to expose the bone that's underneath it, and that hurts. What is a dry socket, and how can I avoid it after a tooth extraction? Exactly what I just said. A dry socket is basically a situation where a blood clot didn't form, like a scab, a mouth scab, like you have a healing scab on your skin. It doesn't form, or you dislodged it either with hard food, sucking or spitting or just brushing too hard, that's going to create a dry socket, and it is quite painful because it exposes the bone and the nerves, right? So when that happens, you give us a call and we put some medicaments and medicine in there to help it feel better. But that's a dry socket, and to avoid it, just don't suck or spit. Like if you get a tooth extracted, don't spit, don't suck, don't kiss, anything that goes in, force goes in, or force goes out, something that'll move that soft scab in your mouth, the blood clot, that you don't want to dislodge. Okay, so that's how you avoid it. Key advice there. Okay, how long should I wait to exercise after a tooth extraction? You know, it really depends, because I just recently had a teenager. I took her tooth out, and I'm like, yeah, you know, the orthodontist recommended taking the tooth out, baby tooth. It was pretty simple, and bleeding was contained. Go swim. Good, jump in the pool right away. Some cases, a lot of cases, no, you wait like 2-3 days, okay? Sometimes a week, it just depends. If you get your wisdom teeth extracted, you're not exercising for about at least 4 or 5 days, okay? Not 4 days, because especially if your teeth are impacted, because there's a lot of there's just a lot of swelling in there, and you don't want to be like breathing heavily and dislodging, or you know, just lifting and just dislodging the blood clot, okay? The scab, the healing blood clot. Okay, how long should it take to recover from a tooth extraction? Well, if you're talking about how long it's complete healing, usually about 6 weeks for most people, anywhere between 6 and 10 weeks, okay? So it takes about 6 weeks for the bone to kind of build over. Now, if you're having a bone graft where they added a bone graft, that takes about 3 months for it to settle in and really solidify it and become stable. You're looking for stability, okay? So it depends. An average 6 to 10 weeks, but case by case, ask your dentist. They'll let you know, because every person's special and every case is different. When should I schedule an appointment for a tooth extraction? Well, as soon as your dentist recommends it. Don't wait, especially if we tell you about wisdom teeth. Oh my gosh, especially with the lower teeth. Okay, the lower wisdom teeth, if you wait too long, there's a long nerve in here that's really close to the wisdom teeth. And if the roots grow close to it, then you may be in a situation where the risk of damaging that nerve is too high. So then those teeth have to stay, okay? But that's only if you wait. But just to avoid pain and complications, don't wait. When we tell you to take a tooth out, just take it out, okay? Otherwise, you're gonna complicate things for yourself, or, you know, you can wind up with unnecessary pain, infection and pain. So just avoid that. Do it when the dentist tell you. Remember, we have your best care at hand. We're really trying to look out for you, okay? All right, so hopefully this video has been helpful for you. Go ahead and put a like, share, and subscribe to the channel. All right, so any more questions? www.orindadentist.com, 925-254-4043. All right, I'll see you at the next video. Bye-bye.